New data shows that Tennessee is the worst state in the country when it comes to opioid use disorder. And thanks for staying with us. I'm Josh Rowe.
And I'm Kim Chapman-Whitfield. Axios shared that data, first released by Fair Health. Here's their map showing the number of opioid use disorder diagnosis cases in 2024. The darker colored states are the worst hit ones, and Tennessee shows up with more than 1,400 cases per 100,000 patients.
What's more, that's compared to just under 400 patients treated only 3 years before, back in 2021. All that translates to almost 3,000 opioid overdose deaths in 2023.
And now, as News Channel 9's Katie Glanton shows us, Hamilton County has a new tool to fight those numbers. Katie.
Josh, Kim, Hamilton County is trying to bring down fatal overdoses and chronic use disorders with this new team they say is the first of its kind in the state of Tennessee.
You know, we can do that for them. It's less stress on the family. I know it would have been on mine.
It's Andy Miller's first day on his new assignment as part of the Hamilton County Overdose Prevention Team.
I've been in the back of several of the Hamilton County ambulances for overdoses. I believe it was Medic 1 that picked me up the first time.
The new program, paid for by opioid abatement funds, goes beyond the initial emergency of giving treatment, like Narcan.
By providing medication-assisted treatment in the home to any willing participant at no cost, with personalized connections to local resources for recovery.
The 8-person team includes paramedics and peer support specialists like Miller.
Been through those things to dare to explain that to me. I think that would have taken a lot of the anxiety and fear out of the situation.
The most recent Hamilton County report shows fatal overdoses are actually trending down by 38% in the last 2 years. But this team is hoping to make even more progress, something Miller's not sure he'd be around to help with if it wasn't for his father.
If it wouldn't have been for him, you know, being a paramedic and having, you know, some supplies at home to keep me breathing, I wouldn't be here.
This program's target is mainly for opioid overdoses, but can provide resources for all kinds of overdose treatment. If you know someone that would benefit from this program, there is a number you can call for referrals, and that number will be on our website. Kim.
Katie, thank you. The CDC data from last year also showed the opioid epidemic also dragged down the state's total life expectancy by more than a year to just over 72.